Thank you so much for being a supporter of the Kidney Foundation. As part of our research roundup follows an interview with Dr. Peter Nickerson, co-chair of the Kidney Foundation's Research Council, which governs the research granting process. He will give us a snapshot on the Kidney Foundation's research and grant funding process, because all of this exciting work is being done to improve the lives of kidney and transplant patients. This is all due to your support. Thank you. So we are so pleased to have Dr. Nickerson with us here today, all the way from Winnipeg. Hello, Dr. Nickerson.
Hi, Ramya. Good to be here today.
Excellent. Thank you so much. So let's get started. I think my first question is, can you tell us a little bit more about the Kidney Health Research Grant Competition?
Sure. It's a competition that the Kidney Foundation has been putting on for years now. And it's probably seen by the kidney community as one of the vital mechanisms of actually advancing kidney health research in Canada. These are grants that are provided to researchers to support them in terms of their operating dollars, to take an idea from its germination all the way through to its fruition and ultimately see advancing care for patients with kidney disease. What
would some of those operating costs be?
Yeah, so this could be for your research personnel in the lab, or it might be a study nurse that's working for you. It's for the technical costs of supplies. It might also be for developing or getting access to various services like data analysis, this sort of thing. So it's really the operating costs of running the project.
All those little things that we don't think about.
Exactly.
As we talked about, these are the things that the grant covers, and that's what they're used for by the researcher. What does the application process look like, and how are the award recipients decided?
Yeah, so another great question. So this is a very rigorous process. It goes through a thing called peer review, which are other researchers and scientists in Canada who have knowledge in the area of kidney health or kidney research. And essentially an individual who's a scientist or a clinician or even an allied health professional, they'll have an idea, a hypothesis of what they think is true, and then they'll put down on paper in their application exactly how they're going to prove or disprove this idea. And many times these ideas need to have some preliminary data. They need to, what's the evidence to support this? What do we know from the prior evidence that's out in the literature? So the researcher will bring all these together and they'll write it up in their application. And then that application goes to the committee that reviews through this peer review. A couple of individuals will go in detail into the proposal. And they'll test and figure out whether they think that the person has made in their proposal sufficient evidence to support why they think what is true is going to be true. And they'll look at the planned experiments that the person is proposing, so that at the end of the point, if they feel that this is a high likelihood of success, it's addressing a very important question to the kidney community, to the patients, then they'll support that to go forward for consideration of funding.
That does sound like a very complicated process.
It's complicated, but I think what it does is it puts real rigor into the process, so that when somebody gets money from the Kidney Foundation actually knows that person has a high likelihood of success with their area of research, which I think is really important to the donors and the people that are supporting the Kidney Foundation, because they want projects that they think are going to go forward. So our goal as the review committee is to make sure that there's enough thought and justification so that we actually see the dollars spent in a very well and wise manner.
So, on that note, can you speak to our different research committees that are involved with this process? So we have a Research Council, Kidney Health Scientific Committee, Allied Health Scientific Committee, and the Crescent Committee, the role they play in deciding the grant recipients and what this process looks like.
Sure, so you're right, there's a lot of committees, and what that really speaks to is that this is a large team effort of Canadian scientists and researchers coming together to review all the proposed research that we get every year. Starting with the Crescent Committee, this is a committee that's looking at young up-and-coming stars in the kidney research community. These are generally individuals who have completed their clinical training and now they're wanting to pursue a research career, which means they're taking 2 to 4 years to get additional training in how to do research. And what the Crescent Committee is doing is reviewing who are, of all the applicants that are coming forward, who are the ones that have the most exciting projects that the Kidney Foundation really wants to get behind and see this person advance their training in this phase of their career. And then the Crescent Committee also looks at the people who have finished their research training and now are coming into early career investigators. And the Crescent program supports them not just in their training phase, but now coming into the next phase when they're going to be the junior faculty. And they're also looking at making sure that that science is going forward. So Crescent Committee plays a very important role in really looking at the next generation of scientists in kidney health research in Canada, and a really important committee. The Allied Health Scientific Committee, this is a committee that's really looking at individuals outside of medicine. So this would be, for example, nurses, psychologists, social workers, it could be technicians, biomedical engineers, dietitians, physiotherapists, pharmacists, occupational therapists, the rest of the team that works with physicians really that are advancing research. And many times the allied health research community has excellent questions to be asked that are really important for patients. You know, it's not just about what's the latest new drug that's going to be treating somebody, but it's really looking at the person as a whole and looking at that person in a holistic way. Many of these other allied health professionals have really good ideas that are addressing patient outcomes directly. So this is a really important area of research, and it's a very important area of research for our patients. And they're the ones that many times tell us what are the key questions to go forward. So this committee is looking at proposals that's coming from that allied health community. And they're trying to find what are the right questions that are really pertinent to patients. And in addressing these questions, how is it going to advance patient care? So again, that's at that committee. And then the Kidney Health Scientific Committee, that's one of our largest committees. They get about 60 to 70 grant applications a year. This is by the PhD scientists or the clinician scientists that are in Canada doing kidney research. And these are the proposals that they all go through rigorous peer review, but this is probably one of the biggest committees. Instead of taking a half a day to go through the applications that come to some of the other committees, this is generally a 2-3 day process.
So what is the peer-reviewed process, and why is that essential to our granting program?
So we have a fairly large committee. It's usually about 40 or 50 people. They're reviewing, not only are they reviewing probably about 7 or 8 applications themselves, but they're hearing all the other people and their reviews, and they're also voting towards what they think is the most important research that has been well justified by the scientists coming forward. So that's the Kidney Health Scientific Committee. All these 3 committees, they're the ones that are reviewing the science that's coming forward from either the medical scientific community, the allied health community, or from the up-and-coming stars in research in Canada. And they're the ones making recommendations ultimately to the Research Council. And the Research Council is comprised of the chairs of these various committees, plus public members. And the public co-chair of the Research Council brings to the table that they're representing the interests of the kidney community at large, representing both patients and their families to make sure that we're on track, right? So we might think that we're on track, but we need that gut check and the validation from the public, because ultimately that's what we're here for, is the patient care and advancing ultimately outcomes for our patients. And so we want to make sure that our priorities are aligned with what the patients are telling us are the important priorities. So that was a long-winded explanation, but these committees really are the essence of where the Kidney Foundation invests, how they decide to invest, and making sure it's accountable ultimately to the donors and to the patients.
And truly a collaborative effort from all perspectives, which is very good to hear.
Absolutely, and in fact, all these committees, not only do they review the science, but they actually provide critique. So even when a application is awarded, the person gets feedback on their grants and they say, hey, why don't you tweak it this way? And it will actually be a better grant and a better proposal. And so the feedback that they get really from the community at large is advancing the science as to make it as good as it can be.
Very interesting. Thank you for that explanation. So we touched on this a bit, but do you have any additional notes about what exactly a peer-reviewed process means and why that's essential to the granting program?
Well, again, I think this peer review is really the idea that when you're submitting your grants, your science to be reviewed, it's being reviewed by your peers. So that could be other allied healthcare individuals who are in research, or clinician scientists in research. Because we're embedded in the whole area of research, we're well positioned to understand what is or what isn't going to be feasible, what is likely or what is not likely to work as an idea. And by giving that rigor to it, it really is making sure that the money that we're spending is really directed towards what is going to have the most likelihood of success. So that's peer review. It's a critical element. It's really how it's the whole foundation of science. Not only does the Kidney Foundation do this, but all grant research councils in the world do peer review as a mechanism of making sure that the best science is going forward, and it's going forward with the best ideas that are being tweaked along the way by giving advice back to the researcher.
Well, exactly. And as you say, that feedback that you give back to the research applicants, whether they be successful or not, is so valuable to them, I'm sure.
Absolutely. In fact, probably one of the best learning experiences is to not get funded, to get the feedback, and it actually causes you to rethink what you were proposing. And you look at, yeah, I could have done this better. And many times you'll come back a second time into the competition with a much better grant than you had the first time. And everybody will recognize that you took the feedback, you integrated it into your proposal, and now they're happy to fund this because they realize that you've got onto the right track now. So, peer review and the feedback, it actually makes science better.
Excellent. Thank you so much for that. So let's talk about the Crescent program a little bit more. It involves a number of awards, actually, that support individuals in various stages of their career. So what do you see as some of the innovative highlights of this program to support young researchers beginning in their career?
Sure. So, we talked a little bit earlier about the idea that the Crescent program is both taking people who are finishing their clinical training and now they're beginning to learn how to be a researcher. And so during that phase of their career, what's really important is they actually not only do their research project, but they actually get trained in how to write a grant, how to write a paper, how to put a budget together, how to run a laboratory, how to do peer review well. So all the tools that you need to be a good researcher, the Kidney Foundation, through the Crescent program, which is a partnership with the Canadian Institutes for Health Research, really spends time training you in the key things that you would need to learn to be a good researcher. And that, again, is invaluable. Without the Crescent program, what used to happen is you would get your research funding to do salary support for you as a trainee. You would do your research, but then it was hoped that you would learn these other, what you would call soft skills along the way. And for many people, that didn't happen. And I think the aha moment came several years ago when the Kidney Foundation said, no, we've got to stop. We've got to make sure that we're training these individuals in the skill sets that they need. And what we've seen since that time is that the people that complete the Crescent program not only are very competitive for Kidney Foundation grants, but they're very competitive for national grants through the federal government, like CIHR or NSERC-based grants. So it really is a key element. And then the second phase is this phase of, you've been trained how to be a researcher. Now you're going to be junior faculty. And, coming on and setting up your own lab while you've been told what to do and how to do it through the Crescent training program. In this phase, it really is bringing it home. And this really provides a community of junior faculty from across the country that come together regularly, and they learn from one another what's working, what's not working. And I think it really has, what we've seen is this kind of concept of a collaborative community of researchers. These are all people who have grown up together, if you will, at the same time, either through their training phase or junior faculty phase. And this has created such a close network in the country that now these people are doing research collaboratively together. And so they actually start forming networks across the country. And that actually has huge power, because what I can do in my local site, for example, in Winnipeg, if I really want to move this idea forward, I actually need a collaboration with 4 or 5 other centers in the country who want to do the same kind of research. Well, if you have that network established through the Crescent program, it's so much easier to pick up the phone and say, hey, let's do this project together. And conversely, the other person calls you and says, hey, I really need you to enroll your patients into my research program. Can you do that for me, right? So now you've built up this network that works collaboratively together. And I think that's probably, again, one of the big payoffs that the Crescent program has had.
So Dr. Nickerson, I'd like to talk a little bit more about our Allied Health Research Grant Funding Program. Can you explain what an allied health research field would be?
Sure. So allied health professionals, these are individuals like nurses, psychologists, social workers, technicians, biomedical engineers, dietitians, physiotherapists, pharmacists, occupational therapists. So really it's the whole team that looks after an individual. So it's not just a physician or a basic scientist doing research on kidney disease. It's actually a whole team of individuals that are potentially involved in that research. And many times the allied health researchers are asking questions that are really pertinent to the patient. In fact, many times they'll have groups that they'll bring together of patients and say, hey, what are the important questions for you? What are the things that if we could do some research on, that this would actually improve your daily living, your ability to participate in various aspects of life. And so the allied health is really patient-focused in their research. And so we have different types of grant funding. We have a doctoral fellowship. So these are individuals who have completed the clinical training. So a nurse will have completed her RN, her BN. And now they're interested in pursuing a career in research. They don't just want to go and work clinically, like a physician who wants to do research. A nurse who wants to do research might want to go on and do her doctoral studies, her PhD. So then she would apply to the Allied Health Kidney Doctoral Fellowship, where this would support her salary while she's doing her doctoral studies and training, which generally is both courses, writing a thesis, and conducting research related to obviously kidney health. And then we have the Allied Health Kidney Research Grants. And so this type of an individual, they finish their training, now they are on faculty and they're doing research. They also need a source of funding to do their research. Again, supporting either staff or supplies or services like data analysis. So we have an Allied Health Kidney Research Grant, which would give up to 2 years of $60,000 a year. So really substantial amount of money to allow that individual to conduct allied health research in kidney health.
I love that patient-centered focus on research that you touched on there too.
Yeah, no, I think we as a community as a whole really have changed our focus in the last decade or more now to be much more patient-focused, realizing that the patients really, have critical issues that for them they want answers to, and if we listen to them, many times we can be on track. And in fact, I think the patients feel that their lives are getting better through that types of research.
So from your experience on that note, do you and the research community see any really exciting key opportunities in the kidney health and organ transplant research fields moving forward? Right.
So that's a loaded question. It's so massive. Like you could think about all the things that are going on. I think one of the things that I've really seen happen in Canada is, we were talking earlier about networks of researchers. In fact, there is a national network in kidney research, and this group has really come together, and many of them are former Crescent trainees, allied health doctoral fellows, and they together are having large-scale plans that's being funded by the Canadian Institutes for Health Research, where they're looking at various aspects of kidney health. So early detection has become a real top priority. And there's many groups in various types of communities, not just urban communities, but rural, remote communities. How do we actually screen these individuals early for kidney disease? And a lot of research has been going to develop the technologies for that, to develop what types of things should we be testing for, how should we be screening early for kidney disease? And then once we detect that, what's the research that we have to how do we intervene, right? How do we actually either get them onto proper diet, right? Exercise, things that could improve their processes, so like how to treat hypertension through non-pharmacologic means. How do we, early on in diabetes, how can we control the blood sugar better? So there's a lot of research in these aspects around prevention, if you will, early detection, prevention. And can we predict, can we tell somebody how long it's going to take for them to get to the point where they might need dialysis or they might need a transplant? So there's a bunch of researchers in Canada looking at developing models or equations that actually say, okay, you're 50 years old, you have this blood pressure, you have this kidney function today, you have protein in your urine or you don't. How do we integrate all that information together to try and predict the future and give you some sense of where things might be going over what period of time? So that kind of research has been, actually, Canada has been leading in many of these areas of research. When we talk about organ donation, another area that's really important, obviously, for getting kidney transplants available for our patient population. There's a lot of research going on through national networks that are looking at how do we preserve the donor organ optimally so that it can last the longest once we put it back into somebody. And so there's a lot of research going into protecting the organ. How do we actually start thinking about the next phase, which is actually start treating the organ before we put it in to make it work better, more optimally. So there's a whole area of research that's really exciting there. And other research that's going on is really looking at not only working in humans, but going into smaller animal models, right? The idea that, we have a model system of a disease that we see in patients. Can we actually identify the fundamental biology of that disease? And so there's a lot of our PhD scientists doing that kind of research. And the interest there is that they identify new targets, right? That if we identify the mechanism of how that disease is coming about, then maybe we can design a drug that can address that problem. And that drug might take many years to come to fruition, and it may take many years through different types of federal funding and ultimately in collaboration with the pharmaceutical industry. But you can bring these new drugs to the clinical community. And we've just had this last couple of weeks at the International Cardiac Convention, where the scientists were sharing the results of some recent clinical trials looking at these novel drugs that have come out. Now, these weren't necessarily coming out of Canada, but there's an example of what the types of research that we're investing in, where these novel drugs, SGLT2 drugs, actually are showing that they can slow the progression of kidney disease, and they can actually improve heart health in individuals with kidney disease. So this kind of it's really exciting to us in the clinical community that we have a new class of drugs that actually can improve clinical outcomes for patients. But that started 20 years ago in basic research. And so what we're interested in, and many of what the Kidney Foundation has invested early on, is some of these early discovery type grants that, yes, we can identify something novel. And while it may take us a while to get there, it ultimately will potentially either delaying the rate of progression or leading to improved clinical outcomes.
Well, and for example, so the SGLT2, I think you said, trial that you talked about, is that in human clinical trials yet, or is...
That's through clinical trials now. So now they're looking at getting to SGLT2, yes, inhibitors. These class of drugs has finished their phase 3 clinical trials. And so it's coming out It's out now and available in clinical care. So these new what were molecules becoming drugs. That type of research is the research that Kidney Foundation's also involved with. And then some of my own research that the Kidney Foundation has been partnering with in the past has been, I'm interested in transplant, and I'm interested in the compatibility between the donor and the recipient. How do we find the best donor match for the recipient, and how much does that matter in terms of clinical outcomes? And so we're seeing development of this technology moving forward, that we can actually not just say, okay, any donor is good, but how do we find the optimal match for you so that kidney, when you receive it, will last for many, many years. So again, lots of exciting things going on in kidney research, and it translates into not only basic science, but clinical science and allied health research, improving patients' lives and trying to prevent or slow the progression of their disease.
So Dr. Nickerson, I'd love to know from your experience, what are some exciting outcomes that you've seen through research in the previous years?
Yeah, sure. So in our own research, we've been looking at a couple things. When we do a transplant, some of our research that was funded early on by the Kidney Foundation was around how do we make sure that the donor and the recipient are compatible. So we look in the blood to make sure that the recipient hasn't developed antibodies towards the donor, because that would cause an early rejection in the transplant. And so the Kidney Foundation funded us to develop that assay further from what it had been. And we became one of the first places in Canada to develop it. Now everybody's using it. And we're seeing that by using and applying what's called a flow cytometry-based cross-match, we're having better outcomes in our transplant. We're avoiding these early rejections. And then the other thing that led to was it led to us saying, a lot of patients are very difficult to get transplanted because they have so many antibodies in their blood. They can only find one donor that might be matched to them, given 1,000 donors, right? So how does that one donor get to that patient that needs that one kidney because they have the right tissue type and the recipient doesn't have an antibody to them? And that led to us taking this technology, saying this has to be the standard of lab practice across the country. And when we did that, we then were able to get the government to support Canadian Blood Services to develop the national sharing programs for kidneys. And so we now have a national highly sensitized transplant program. So if you have lots of antibodies in your blood, you get on the national registry. And if a donor is available anywhere in Canada that is predicted to be matched to you because you don't have an antibody towards them, then that kidney will be shipped to that recipient. And we've done hundreds of transplants now across Canada for people who had been years on the wait list, waiting for that perfect match because they could never find it. And now they actually are getting transplanted. And so I think the longest we had was someone who was like 16 years on the wait list, waiting for that perfect match. And once the program started sharing kidneys in this way, they were able to get their match and get transplanted, when people thought they were never going to get transplanted because they couldn't find the needle in the haystack. And that same technology also allowed us to set up the Living Donor Paired Exchange Program through Canadian Blood Services. So this is where, my sister wants to donate to me, but she can't because I either have antibodies towards her or they're not the right blood group match. But we can go into this national kidney pair donation program, and that program then can find another couple that are incompatible to each other. But you know what? My sister could donate to, say, some other individual, and that other individual's donor could donate to me, right? And now we both get transplanted. And what's really interesting about that is that even though my sister didn't donate to me, many of the patients will tell us, it still feels like she did donate to me because without her, I never would have got a kidney, right? So that whole program came about because we did research to figure out how do we standardize all of our lab practices to create a very reliable diagnostic tool that could say that, yes, if I ship a kidney across the country, it will in fact be compatible to the individual that we're shipping to. So that's an example of how Kidney Foundation invested early on 20 years ago in our research. And that, not the only thing that led to it, but it was a foundation that we could build on to then develop the national sharing programs, both through kidney pair donation and the highly sensitized registry. So that's an example of the power of research to really create solutions for patients that now is leading to hundreds of people getting transplanted that otherwise weren't going to get transplanted, or allowing donors that were, because they were incompatible, would have been turned down. But now they're allowed to go in and be a donor through the kidney pair donation program.
Well, it's really exciting to hear you kind of address, just in 20 years, all the outcomes we've been able to have to increase access to organ donation.
Yeah, no, I think Canada has recognized that we're not performing near the top in organ donation, but, through these types of things, we're moving ahead. And we're getting people transplanted that previously were not having access to a transplant because they couldn't find that needle in a haystack.
And again, I really like how you address the variables from looking at research from the prevention side of, when we have risk factors or right before they start developing serious kidney disease, looking at that risk factor and that prevention process all the way over to organ donation as well.
Yeah, no, the Kidney Foundation has a very broad mandate in its patient-focused research. So I think it's really one of the key organizations in Canada to help patients with kidney disease.
So Dr. Nickerson, we're living in a very different time right now, in the time of COVID-19, and I'd really be interested to hear your thoughts on how this pandemic has impacted kidney patients and also how it affects the field of research and the work that you folks do.
Right. So, COVID's been very trying from the perspective of, and I have sort of a unique perspective being the Vice Dean Research at the university. When COVID hit in March, we had to shut down all of our research labs because we weren't really sure how we were going to best deal with this. So we went down to a very skeleton version of ourselves through end of March, beginning of April. At the same time, I'm also the director of Transplant Manitoba, the medical director of Transplant Manitoba. And so we had to deal with what are we going to do for our patients who are immunosuppressed in the face of a pandemic. And so in a similar manner, we started looking at how big was the community burden of COVID. And I can tell you across Canada, we went into a mode of ramping down, first of all, living donor transplants. We sort of canceled them early on because we recognized that we didn't have all our testing or our PPE or our pathways in the hospitals in place to protect the patients optimally as we would like to. And so all of the living donor programs pretty much shut down. And the deceased donor kidney programs, it really was about ensuring the protection of the patient by making sure that the donor didn't themselves have COVID, right? Because while there's very little evidence that a donor can transmit COVID through an organ transplant, we didn't know enough at that point to know what we could or couldn't do. And so the Canadian community, we've been talking networks, all the organ donation and transplant community was on a weekly phone call talking about how do we set a policy and a procedure to optimize organ donation and at the same time protect our recipients. And so we went through a whole phase of ramping down and then ramping back up. And what I would say now is we've learned a lot. We've learned a lot about PPE. I think the whole world has learned about PPE and masks and whatnot. But we've worked with the hospitals to create what we call green zones or pathways where a patient, it's safe to come into a hospital, it's safe to go through a surgical procedure, it's safe to be on the ward. The risk of transmission of COVID is very low within the hospitals. And so with that, we could safely reopen our both our living donor programs, our deceased donor programs have become more optimal. And what I'd say is we did have sort of a lull, but we've now come back up. And we're now, I can tell you in Manitoba, we've been doing catch up with our living donor programs. So all the living donor transplants that we paused, we've now managed to get through surgery and to have those transplants take place. So that was an impact on our transplant and donation community. And then more importantly, I think it's also been as we've reopened not only our research labs, because they've all reopened now, because we've again learned the same how to create a protected pathway for being able to conduct research in our universities and in our hospitals. But for our patients in general, not just transplant, how do we make sure that, patients were scared to come into hospital. They didn't want to come to clinic. And so we've actually learned how to do virtual visits. For the same way we're doing a Zoom meeting for this interview, we are having virtual visits with our patients. So they'll go to get their blood work done in a lab, and then we'll have a call with them. And in fact, it's going to change medical practice, I think, in general, because now our patients are like, well, I don't want to come to the hospital when this is all over. I like having these virtual visits. I like the fact that I don't have to travel to see my physician or to talk to my medical care team, right, with my allied health workers. And so that whole concept of virtual care or telemedicine, I think, is going to explode, and it's not ever going to be the same again. And I think that's for the good, actually, in some ways, because, in Manitoba, we would have patients traveling from the far north down to Winnipeg to get seen. Well, now we're doing virtual visits and caring for them in their communities. And I think that we're going to, as we've built capacity for that, this was always coming. COVID has accelerated that by several years. And I think we're going to maintain that going forward. Now, obviously, there's always going to be times when you need to see a patient in person. And so we've, again, worked towards, and the whole country has been doing this, working towards making sure that when the patients do come to hospital or to clinic, it's a safe thing for them. So it's impacted not only clinical care, it's impacted our research, but I would say that we've learned how to deal with it. We've learned how to create safe environments. And nothing's going to be perfect, but I think we're doing a great job now in the country in moving our research along and moving our clinical care along, despite these trying times, which I think is going to be with us for a little bit yet.
And I like how you touched a bit on the remote populations and rural populations that perhaps now they can see their specialists with a little bit more ease as well.
Yeah, no, I think the patient experience, again, we talked earlier about being patient focused. Well, this is really what at the heart of even being more patient focused. And I think it's going to lead to timely care and obviously less burden on the individual for the costs of coming down. Like you say, well, you come down, you get reimbursed some of your travel costs. Well, yeah, but you never get 100% reimbursed for everything, right? There's always the little things that add up. So I think for patients, it's going to lead to better care overall.
Speaking of patients, what are your thoughts? Are you seeing a lot more dialysis patients moving to home dialysis care versus in clinics?
Yeah, so I don't deal day to day with the home hemo or in-center hemo because I'm more on the transplant side, but certainly our whole attitude has been about trying to expand home hemo modalities, be it hemodialysis or peritoneal dialysis, as much as possible. And we've advocated for that over the years. And I think, again, we have even more reason to try and have that happen going forward.
Excellent. Thank you so much. Is there anything else that you would maybe like to highlight about kidney research, the importance of funding it right now, or other KFoC funding programs?
Yeah, so I just want to maybe go back. A lot of the research that gets, like my own research, it got initiated through the Kidney Foundation, either through training programs, where I've had my own students go through the Crescent Program, or an operating grant from the Kidney Foundation. And that, we're not, when we talk about scale, we can think about how big is this money? Well, a Kidney Foundation grant, $60,000, used to be 50, now it's 60 for a couple of years. That money as seed money launches so many great projects. And what the investigators are able to do is to take that money, get the data that they need for their ideas and their research, and then turn that into a bigger grant through the federal government, like the Canadian Institutes for Health Research. And what that's doing is leveraging millions of dollars, right? So the amount of money that the Kidney Foundation, it might be seen as not big enough. I would say it's great. It's seeded so many great ideas and it's leveraged many millions of dollars of research into kidney health. This is a very critical role that the Kidney Foundation plays, because many times the federal agencies say, well, come to us with your big idea, right? But if you don't have that preliminary data, if you haven't done some of the initial studies that you need to do, and you don't have money to do that, then you can never get the focus on kidney health from the federal government. So I think what the Kidney Foundation allows many of the researchers in Canada to do is to launch their careers, launch some new ideas that you have, and get it to the stage where you can actually leverage many more dollars. And so I view the Kidney Foundation, if we want to have research with a focus on kidney health, if we don't have the Kidney Foundation, if we don't invest in the Kidney Foundation through our donations, there will not be that national focus in kidney health research, because many of those ideas came out of funding from the Kidney Foundation.
So Dr. Nickerson, I want to thank you so much for being here with us today.
Well, thank you, and it's been a pleasure to talk about the programs at the Kidney Foundation, the exciting things that you've been investing in and will continue to invest in. And I look forward to the opportunity when we can all get together again and celebrate some of the things that are going on inside the kidney health research community.